More and more people are relying on their mobile devices. They're never too far away, ordering groceries and takeout and planning curbside pickups or just scrolling through social media, especially over the past several months. But if you're over 40, you may have noticed that you have to pull that phone a little further away from your face to read it. I actually suffer from the opposite. I've got to put it right up to my face and take my glasses off. So I feel personally attacked here, but you're here to help me. Did you know that even though not being able to see up close is just a normal part of getting older, you don't have to live with it? Joining us this morning is Dr. Tremblay of Mann Eye Institute, who's going to tell us more and give us some solutions. Good morning to you.
Yeah, good morning. Thanks for having me back. It's good to be on.
Our pleasure. It's really great to see you all again. You always bring such terrific information. And this is something that a lot of people are experiencing. This, I can attest to it personally. What causes us to lose our close-up vision after 40 years old? It's almost like something just clicks. And does it have a name? Does it happen to everyone? Is it just me?
No, it's not just you. Unfortunately, it does happen to every single human being on the planet. It's called presbyopia. It's kind of a funny word. But essentially what this means is as we're young, we have a lens in the eye that's clear and it's mobile. It's a very soft lens and it can change shape very readily so that it can focus both up close and at distance. But as we get into our 40s, and typically this happens sometimes on the 40th birthday, you know, I've had patients tell me that when they turn 40, the next day they started to notice this. But usually it's early 40s to mid 40s. That lens becomes a little more dysfunctional. It can't focus both up close and far away. So while you maintain your distance vision, it's a struggle to see your phone or to read something. And as this gets progressively worse, which it does into your late 40s, 50s, and beyond, you then start to have to either hold things out farther or put some reading glasses on, which can be a real burden.
Right. And is this a kind of thing that is a little temporary? Is it something just a little blip, or does it actually get worse?
No, it gets worse. So this is something that starts as mild and you can get away with holding something out farther. The nice thing about technology now is you can increase the font size, but there eventually gets to be a time where you can't even see that. So it gets progressively worse in everybody, and eventually you're going to have to start wearing those readers. But luckily we have some potential other solutions for this if glasses aren't your thing.
Yeah, I mean, that's a great point. So we don't necessarily have to be sentenced to glasses or readers or cheaters, as some people call them, for the rest of our lives. Tell us a little bit about some of the options and how we know which one might be right for our eyes.
Sure. So luckily today we have a lot of technologies. The first, if you're in your 40s and early 50s, LASIK surgery may actually be a great option. What we do typically in LASIK surgery for this condition is we set you in what's called blended vision. What that means is that we take your dominant eye and we put that out to distance. So we correct it for distance so you don't have to wear glasses to see far away. And then we leave your non-dominant eye slightly nearsighted. So that maintains your near vision as well. And it's a blend. So the brain is pretty sophisticated and it's still able to blend those two images together so that you still get the full range of vision. And like I said, it's a great option if you're kind of in your 40s or early 50s. As you get into your mid 50s and beyond, blended vision may not work as well because, like we said earlier, this condition does worsen with time. And it does get to a point where blended vision's just, it's too much of a difference between those eyes to really compensate. And so in those cases, we actually recommend what's called refractive lens exchange. Now, this is essentially cataract surgery, but it's for somebody that doesn't quite have cataracts yet. You know, cataract is basically clouding of that lens. It's kind of the same process that we talked about, but that's usually in somebody that's in their 60s and beyond. If you're in your 50s and you're struggling with presbyopia, we go in and do what's called refractive lens exchange. We take the lens out, which again is the problem, and implant a newer technology, which is a prosthetic lens, which helps you see at full range with both eyes. We've got some fantastic new lens technologies now, and these are completely getting rid of glasses in most of our patients.
That is fascinating. There is such incredible technology that's being developed for these issues. How does someone know, you know, which might be good for their phase and kind of get started with this process? What's the best way to begin if we have questions?
Right. So, you know, I kind of gave some general age ranges, you know, 40s and mid 50s, maybe LASIK surgery, and then beyond refractive lens exchange. But that's a generalization. And some people in their 40s may benefit from lens exchange, whereas some people in their 50s may benefit from LASIK. So it's really a personal thing. The best way, honestly, is just to come in to, you know, us or an eye doctor, have an evaluation, and we can guide you in the proper direction. And there's a lot of factors involved. So we'll put you through a battery of testing and really do a comprehensive exam to make sure you're getting the best technology available.
That sounds perfect. And I know plenty of people who have had such great success with your techniques there at Mann Eye Institute. And I'm told it's really a life-changing procedure. And it sounds like there are even more advances coming up. Where can we go, Dr. Tremblay, to learn more about what you do and maybe book that very first step?
Sure. So you can find our website, manni.com, or give us a call at 1-800-MY-VISION. We'll be happy to see it. And that consultation is free. So come in for that complimentary consultation.
Excellent to know. Thank you so much for joining us today. I'm fascinated by this technology. It's really great to see it develop. And I'm glad we have an expert like Mann Eye Institute in our corner to kind of help us, keep us abreast of the latest eye technology. Thanks for being here.
Yeah, thanks for having me. Appreciate it.
All righty. And stay right there, friends. There's more We Are Austin coming right up.